Michael Tildesley. He's an Associate Professor of Life Sciences at the University of Warwick. He's in Coventry in the UK. Hi, Michael. Thank you for your time. Now, the countries we've spoken about in the last few minutes, Australia, India, Mexico, South Africa, they're all seeing rising case numbers and a resurgence, despite many of them, like Australia, implementing strict lockdowns, which are still underway. So the question is, why are we seeing numbers going up at the moment?
So we have to remember that we are dealing with a worldwide pandemic where many countries went into lockdown several months ago to try to control the spread of the disease. Now, over the last couple of months, several of those countries have started to relax those lockdowns. Now, one of the consequences of going into lockdown, of course, is you suppress the infection, you stop the number of cases rising, and that works. And of course, it protects the health services and it saves lives. But as you come out of those lockdowns, then relatively few people have been infected as a proportion of the total population of your country. And so that means that as you're relaxing controls, we might see cases start to rise. And that's why we're in a situation, sadly, where a number of those countries are now having to introduce controls again in order to curb these potential second waves that may be occurring.
Michael, but surely many governments would have realized and would have got expert advice from the WHO or health officials in their countries that lockdown, as you said, would suppress the infection. But as we start coming out of it, the infections would start to rise. What do governments now need to do to try to curb the spread?
Oh, I mean, absolutely, that's right. And unfortunately, we're in a really difficult situation right now where what we're trying to do, of course, is you're trying to weigh up minimizing the impact of public health and, of course, minimizing the impacts to the economies, because, of course, we know there are long-term implications economically of staying in lockdown for a long period of time. This is what makes it really difficult at this point in time, that what you need to do is do what you can to save lives, but try to open up enough that we are basically protecting long-term people's health and well-being. So it's very, very difficult. And this is why in this phase we are in at the moment, when we see cases rising in particular countries, it's important that we react rapidly. We try to suppress this with local controls so that what we don't do is have to proceed to large-scale interventions again on a global scale to try to prevent a massive second wave occurring.
We're months into this pandemic now. I mean, it's just taken over our lives. It almost feels like we can't remember what normal was, so to speak. There are over 17.8 million cases around the world. Do you think at any point we're going to see these numbers plateau?
Well, unfortunately, as I said earlier, we are in this position where we're almost in a cycle of events at the moment where we're having to put in more serious controls that suppresses the infection. We then relax them so that we can start to get the economies going, and then we see cases rising. And unfortunately, this is a situation we may find ourselves in for the coming months until hopefully sooner rather than later we have a vaccine available. When that's the case, it'll need to be rolled out on a large scale. But of course, we need to remember that any vaccine that may be available may not have long-term immunity. So it really is only the start of the end rather than the end. And so at this stage, we're in it for the foreseeable future. And it's really important that people adhere to controls as much as possible. You mentioned earlier that people were not necessarily wearing masks and social distancing. It's really important that people keep doing that so that we do what we can to suppress the infection, protect our health services, and of course, save lives.
Well, many people are also frankly quite tired of lockdowns. They're protesting these restrictions across the world, and they just don't seem to care and or trust their governments, some of whom have actually been accused of corruption and mishandling of the pandemic. With all of those factors coming into play, it's really difficult to almost look to the future as to how we're going to get this under control.
You're absolutely right. I think there is this concern that if we have large-scale lockdowns for many months to come, then people may start to violate these lockdowns on a large scale. When you've been in this situation for months on end and there's no foreseeable finishing point to that, then people could start experiencing fatigue and there could be massive drops in adherence to control. This is why I think what we need going forward is a balance of factors. We need to allow as much as we can people to start resume their normal lives, but bear in mind that we need to have conditions in place that do what we can to protect the health services and save lives. It's a very, very delicate balancing act going forward, but we need to do what we can to make sure that people do comply with the controls that are in place.
A delicate balancing act indeed. Michael Tildesley, thank you so much for that.